Intussusception is a gastrointestinal condition in which you get telescoping of the proximal bowel into the distal bowel. So what I mean by that is that part of the proximal bowel will basically go inside the distal bowel and cause an obstruction. So the term telescoping is quite appropriate in this case because that's exactly what a cross-section of a telescope would look like. The way that it presents is with paroxysmal colicky pain. So children may present and their parents may complain saying that they have these bouts of abdominal pain which may resolve every time it happens, but it's causing quite significant distress at the time. And when these bouts happen, there may be some pallor, some vomiting, and in certain situations, in SBAs especially, you may get some descriptions of a sausage-shaped mass being palpable in the abdomen. Red currant jelly stools are essentially the description of a bit of blood in the stools of a patient with intussusception, but that's actually quite a late-stage feature which you won't get in most initial presentations. It's investigated with ultrasound because you would actually be able to essentially visualize that intussusception, the telescoping end on, and it looks a bit like that and is referred to as target sign. So imagine that as basically being like looking down the barrel of a telescope. If there's any evidence of obstruction, then an abdominal x-ray may be considered, and a contrast enema can also be done to try and actually visualize the anatomy a bit better. In terms of the management, the first line is something called rectal air insufflation, which is exactly as it sounds. It involves pumping air into the rectum and essentially stretching out the bowel and allowing it to sort of pop back into place. If that is insufficient, or if the intussusception is happening over and over and over again, it may require surgical reduction and broad-spectrum antibiotics as well. The other thing to consider is if there is a patient who presents with intussusception which happens over and over again, they may have some sort of pathological lead point. So for intussusception to develop, you need some sort of slight abnormality in the tube which acts as a lead point around which the intussusception develops. So the Meckel's diverticulum is a remnant of the omphalomesenteric duct, which is present in some people, and it forms this diverticulum, which is normally about 2 inches long, and is found in the small intestine. So that can potentially act as a lead point that leads to the development of intussusception.